So a two-stage procedure would be done if we initially do a craniotomy or the opening and place electrodes, or we call them grids, on the surface of the brain underneath the covering of the brain, which is called the dura. So we will place those and close everything back up, and the patient will then go to the ICU where they're monitored. The monitoring is the same as when they have their inpatient video EEG monitoring, except now we're recording directly off the surface of the brain. So it's a much cleaner and more direct recording. After that is done, it's usually 2 to 3 days. Hopefully people will have seizures, and if we need to, we can also do some mapping for their motor function or speech function or sensory function, things like that. Then we take them back to the operating room and we reopen the opening and take note of where the seizures were coming from. The epileptologist tells us through a picture of the grid which electrodes showed the seizure onset, and then also where it spread. So that's how we know which area to take out. Then we remove the grids from the surface of the brain, we do the resection of the brain tissue, and then close everything back up. If it's a single stage procedure, we do the opening, and we already know what we're going to remove beforehand. And that is the most common thing maybe in temporal lobe epilepsy, where it's pretty straightforward and the anterior portion of the temporal lobe needs to be removed.